on to our third theme session, and I'm really pleased that Professor Celia Marr, who has been a vet in practice, in academia and in referral practice, and is also an editor of the Equine Veterinary Journal, is able to talk to us in her role here as the chair of British Equestrian's Equine Infectious Disease Action Group, EIDAG, and we'll talk about working together to reduce the risk of infectious disease. Thank you, Celia.
Thank you, Pat. Your Royal Highness, ladies and gentlemen, I thought I should start by acknowledging all the people who are contributing to the EID group. There are a number of people there who have a background in internal medicine, which is my own area. So, sorry, there's a mistake on this slide. It's Philip Ivans, Scott Perry, Dave Rendell, Matt Robin. We're all internal medicine people. We have epidemiologists in the form of Richard Newton, a number of contributions from more primary care and sports practice in the form of our newest member, Alistair Crozier, and also, of course, John McEwen and Jane Nixon. And our team is supported from the BAF by Jen Ancliffe and Winnie Murphy. So when you think about why do we need an infectious disease group, why is infectious disease important, I think the answer is fairly obvious. There are two main drivers for this. Rolly talked earlier about the social license, but we don't really need the general public to tell us. We want our horses to be healthy, and infectious disease represents a threat to their welfare, and I think everyone in this room would hope to do everything they can to avoid that. From the perspective of the sporting authorities and the other organisations that arrange and coordinate equine and equestrian activities, then infectious disease effectively represents a threat to the ongoing programs that you organise, and clearly, therefore, there is a responsibility on the sporting authorities and others to do what they can to mitigate that risk and to avoid equine gatherings being occasions when infectious disease spreads and propagates. If we look back at where we were in the past, a good example is, of course, the flu outbreak in 2019, which began to emerge in late January. And was first, I think the public was first alerted really by activities going on in racing. I think it was argued at the time that perhaps it was a little too aggressive, but you have to commend racing for very promptly dealing with the problem. So they stopped racing, they conducted a magnificent effort in sampling and testing, and that was led by Richard Newton and others. And very quickly, they were able to evaluate the threat, understand what was going on in their industry, and get back to business. And actually, it turned out to be a relatively contained and minor problem with around 4 training establishments being affected. And so if you look at the graph here, I just have to figure out where the pointer is. The pointer is here. If you look at this graph, you can see that sort of was going on right at the beginning in early February. So a good start, if you like. Now, if you look at the little map here, these are data that I was provided by Richard Newton and various other contributors here. The UK had 230 outbreaks reported throughout this almost 9-month period. And in comparison to other countries in continental Europe, that's a big number. Now, of course, we don't really know whether perhaps we're just better at documenting things, although there are good epidemiological services in France, Germany, Holland. We also don't know exactly how many horses are there. But I think the real story is in this graph here. So there was no other country in Europe, in continental Europe, that had this phenomenon. We had obviously, as I said, it started 1 or 2 reports, not just in racing, then it kind of took off, as you might expect an epidemic to, and then it tailed off again. But this is the problem. We really did very badly in that we then had a much larger second wave, and as I say, that wasn't seen in other parts of Europe. And there are various reasons for why that might be. The UK has a rather poor vaccination rate when you look at it in herd terms, but of course the timing of this was that the second wave essentially corresponded with an increase in horses being purchased, moving into new properties. There were innumerable reports of outbreak associated with the introduction of an unvaccinated new horse, and of course also various gatherings that went on in the summer. So I show you this really to illustrate to back up my point, which was that if you look backwards, the UK hasn't actually done terribly well at all. And as a result of which, that was a big motivator for the BEF to form this group. So when we think about infectious disease, we can never take away risk. The risk is always there, but we can, of course, reduce that risk. So if you start off with a large risk, it's easy, I think, for people to say, well, to look at what others are doing and say, well, you're not doing it very well, so you're not doing your job, therefore I won't bother doing mine. And I think what we have to understand is that there are lots of different mitigation strategies, and each stakeholder group has their own role to play. So certainly vets are important in this respect, and the organisations, the sporting authorities and so forth have a major responsibility here. But individual equestrians also can take steps to reduce risk. And some of these steps will be small and relatively easy to achieve, but not necessarily have a massive impact. Other strategies are much bigger and will have a bigger impact. But essentially what we need to do is do big things, little things, everybody do lots of things, and you contain that risk. But as I say, it never goes away. So each stakeholder can make a contribution, and we must try to simultaneously do multiple different individual interventions. But the emphasis has to be on shared responsibility and education. So what has our group done? Well, the biggest thing we've done is essentially produced an academic document. We are, after all, a bunch of vets, so we're going to write a document. So we produced it's over 90 pages long, primarily aimed at setting out information for the member bodies that they can then utilise. And that is our advice notes for member bodies. We then took that document and extracted out the bits that were relevant to venues, and that was published online more recently, back in December. And so both of these documents are available. We hope that you use them as a kind of a resource, information source. They are going to be, going forward, going to be updated as and when. And essentially, we've broken down the different strategies into 10 separate pillars, which you'll be glad to hear. I'm not going to go through every one. And within those pillars, in some of them, it was appropriate to set out different levels. So probably the best example of that is in the influenza vaccination recommendations. We sort of split that into 4 different levels, which people can pick and choose from, or organisations can pick and choose from, but it basically separates out into the policies whereby there is a requirement for 6 monthly vaccinations versus 12, and then separating that further by considering how passport checking, vaccination checking is going on. So that's all set out in the document, and it's available to you should you wish to read it. Other examples of what the group does are essentially responding to outbreaks. So we contributed to expertise to help British show jumping manage the return of horses coming back from Valencia in March. And this was an example of essentially being able to take something off the shelf and say, here it is. The policy that we adopted actually was pretty much stolen from the thoroughbred industry, where it's been tried and tested over many years and many different outbreaks. We knew it would work, we had it already, and we were able to quickly swing into action, essentially making recommendations on the use of both blood testing and PCR. Now, the UK is unique in that respect, in that in most parts of Europe you can only use PCR testing, nasal swabs, but we have this blood test which allows us to manage outbreaks more effectively and potentially reduce the quarantine time. And this, of course, is an example of how the equestrian world has benefited from the long-standing investment from the thoroughbred industry. Our group also gets together with others. So in the vaccination shortage, most of the advice that was given to the industry was spearheaded by BIVA, but we certainly made a contribution to the strategy that BIVA recommended, whereby we tried to save vaccinations in the lowest risk group in order that we wouldn't run out for the highest risk group. And then finally, we don't have direct responsibility for education as a group, but we certainly are very keen on helping the BEF's educational mission. And so we supported the first ever Equine Health Week that the BEF had. That was in the last week of November. There is an intention that will become an annual event, and I know that BEF is already talking with other groups about how perhaps we can make that a more industry-wide activity. So are we in a better place now? Well, I think the various points that I would make, that since 2019, where I think it is fair to say there was a bit of a lack of coordination in addressing the flu outbreak, we're now in a much better place to rapidly communicate. So the BAF has set up an emergency response group chaired by Jenny Hall, and we can quickly get together along with others such as BIVA to figure out what should be done. The work that has been done in peacetime, writing the boring 90-page document, means that we can just go straight to the shelf and whip it off. We don't have to start with a blank piece of paper. I would make the point that the equestrian sport, and I think others have made this point, we are still very reliant on the equine infectious disease service that is essentially there to support the thoroughbred industry. And David Mountford alluded to the work that's going on with a national protection plan earlier. Well, I think there are unmet needs. There's a lack of coordination in various areas, which includes the lifelong education and the drivers for behaviour change. I think it's exciting to see that there's going to be a session on drivers for behaviour change later today. There's also a need for surveillance and preventative medicine strategies for the general horse population. In the group that is working, that David described to you already, we have identified UK's top 10 disease threats, and you can see that they're listed here. If you asked someone from the thoroughbred world, they would come up with the same sort of things, but they wouldn't put them necessarily in the same order. So it is time now and important, I think, for the industry to look across itself and figure out new ways for how we can resource this going into the future. And I think it's probably fair to say that there is lack of management structures. I know that this is an important area for this group, so I hope that what I've had to say is of interest. Thank you very much for your attention.
Thank you very much, Celia, for that very important talk. Just to note that we will be taking a few panel questions at the end of the next talk. Our next talk is by Dr. Claire Stratford, and she has also worked in practice and is now the Principal Veterinary Advisor for the Veterinary Medicines Directorate. And she will present an introduction to CANTER, and CANTER is Controlling Antiparasitic Resistance in Equines Responsibly. And this is trying to promote a consistency in the approach to the sustainable control of equine parasites.
Thank you, Pat. Your Royal Highness, ladies and gentlemen, good morning. and thank you to the Forum Organising Committee for this opportunity to present an introduction to CANTER. I'll cover a brief overview of the problem of anthelmintic resistance and then the work of the wider equine community to form a group to tackle this critical problem, and then introduce CANTER, its structure and priorities, and what it means for the equine community. So anthelmintic resistance is the genetic ability of a parasite or worm to survive a dose of anthelmintic or wormer that would previously have killed it. And anthelmintic resistance therefore threatens our ability to control parasite burdens in our horses. The prevalence and extent of resistance is increasing, with resistance reported or suspected to all 4 of our authorised classes of anthelmintic. There are no new anthelmintics expected on the market in the near future, and no evidence to show that once a parasite becomes resistant, that it can ever become susceptible again. So it's critical that we preserve the effectiveness of our current drugs. Otherwise, we risk critical health and welfare implications in our horses, such as an increase in clinical disease, with signs such as diarrhea, colic, weight loss, or even death. And we will also see significant changes in the way that we keep our horses, with us having to reduce our stocking densities and make other husbandry changes to reduce pasture parasite challenge. We know the equine sector is large and fragmented, and it's difficult to reach the whole equine community with a common message. In the livestock sector, the groups SCOPS and COWS, which are pan-industry groups working to promote sustainable parasites control in sheep and cattle, have been very successful at starting to manage some of these challenges. But historically, there's been no equine equivalent. To start to address this, the Veterinary Medicines Directorate hosted an anthelmintic resistance workshop in November of 21 to convene representatives from across the equine sector to discuss this problem and to collectively identify solutions. We identified a number of problems, but crucially, an appetite to work together in a coordinated fashion to address these. And I presented the results and the discussions from that initial workshop at the forum last year, where I displayed this horsehead motif showing the breadth and depth of engagement from organisations across the equine sector. And I'm delighted to return to the forum 12 months on to report on our subsequent progress. So subsequent to the forum, we saw even further engagement in this initiative, and we hosted several more stakeholder meetings to discuss the approach that we should be taking, and if we were to form an equine group, who needed to be part of that group in order to represent and reach the widest cross-section of the equine community. What should the structure of that group be, and what should our priorities be? And what were the main problems that we were facing? So the problems identified were this fragmented nature to the sector, that we have very different husbandry systems in place, with different levels of pasture control and different levels of influence over parasite control, from individual horses kept privately to horses kept on large livery yards. That there was a lack of consistent education about sustainable parasite control, and a need for this education to include information about parasite risk and pasture management, sustainable control strategies, and use of diagnostic tests, rather than just a focus on anthelmintic use. There was inconsistency in messaging that was compromising ability to progress and confidence in approach. We recognised that we needed to see increased use of our existing diagnostic tools, and there was concerns that anthelmintics were too readily available, particularly via online sales, and that an increase in advice at the point of sale was required. And further, that we needed to see significant changes towards behaviour around parasite control and to understand the drivers for this. So whilst we identified a number of problems, we also shared this enthusiasm to take a coordinated response to finding a solution. We all agreed that anthelmintic resistance was a critical health and welfare issue, and that we needed associated coordinated action. There was enthusiasm for this joined-up approach with follow-on initiatives and the need for a pan-industry equine group. And you can find more information with summary notes on gov.uk. So subsequent to these workshops, we surveyed all our stakeholders to understand their interest in participating in such a group and performed a wider consultation. And subsequent to that, we hosted the inaugural meeting of this group in August of last year. And so today I'm delighted to introduce the new pan-industry group CANTER, Controlling Antiparasitic Resistance in Equines Responsibly. CANTER aims to promote and support industry-wide action towards sustainable control. I'm so excited to introduce this group, and over the next few slides, I'll give more information about who's contributed to the formation of the group, its structure, initial priorities, and what it means for the equine community. So CANTER is a new voluntary pan-industry group working in the interests of the UK equine community. And the horse in the motif displays all of the organisations that have contributed to the discussions that led to its formation. And you'll notice that we had to extend the initial horsehead motif to also include a horseshoe as more and more organisations became involved, really highlighting the support for CANTER from across the industry. CANTER has a core steering group that's supported by a number of subgroups. So the core steering group comprises about 20 representatives from across the equine community, so including our 3 prescriber groups, vets, pharmacists and SQPs, diagnostics providers, pharmaceutical companies, researchers, regulators, charities and retail. And we're very lucky to have a number of experts and key opinion leaders on that group. And the group in time will be supported by a number of subgroups that will work towards fulfilling CANTER's objectives, which are to provide evidence-based best practice guidelines to promote sustainable control of parasites, to facilitate education and knowledge exchange, to deliver proactive and consistent communications, to improve uptake and standardization of our diagnostic tests, to consider regulatory or guidance changes to promote anthelmintic stewardship, and to look to address research and data gaps. And these subgroups enable wider participation with the work of CANTER and also start to address those core problems that we'd previously identified. So from those objectives, our priority activities are to produce and publish best practice guidelines for prescribers. And once published later this year, CANTER will work to promote their implementation and uptake across the industry. Alongside this, 3 subgroups have already formed. A diagnostic subgroup that will publish fecal egg count guidelines, looking to better optimize how we collect, process, and interpret these tests. A research subgroup identifying research gaps and funders, and a communications subgroup to develop a communication strategy which will help reach the entire equine community with a consistent message. So what does CANTER mean for you? CANTER aims to support this consistent approach with collaborative expertise and provide access to a single source of truth. We'll be providing evidence-based guidance for prescribers and quality communications for horse owners. And you can find more information on our new website, where you can also sign up, and your feedback would be very much welcomed. So what can you do to support CANTER? Well, we want everybody to be involved. And CANTER's initial call to action is to facilitate an understanding that a horse will have an individual risk associated with its parasite status. Here on this slide, we see a herd of horses grazing the same pasture, but they don't necessarily carry the same parasite risk. CANTER wants to promote dialogue between horse owners and prescribers on a regular basis so that we can understand an individual horse's risk, rather than just reaching for a wormer when it may not be necessary. And for this, we've developed tools to facilitate these discussions. So for this, you can use the CANTER acronym. So C, clinical history. We know horses with previous disease may be more at risk of parasite infection. A, for age profile. Adult horses may be less susceptible than youngsters and geriatrics. N, for the number of horses. The more horses at a pasture, the greater the stocking density, the higher the parasite risk. T, for test results, and using those to inform our decision making, and E for environment. How are those horses kept? Are the pastures poo-picked? Is it a closed herd? Are new individuals quarantined or treated for parasites? And together this makes R the risk profile. This is something to discuss with your prescriber and which will help inform the next steps for that individual horse, which may mean further diagnostic tests, may mean benign neglect at that point and no further action, or it may be the need to use a wormer. You can find more information about this on our website, and you can also sign up for our associated competition. So finally, I'd like to thank everybody involved in CANTER for their contributions and their expertise. We believe that CANTER is the first organisation formed worldwide with the sole purpose of addressing anthelmintic resistance in horses. For CANTER to succeed, we need buy-in from across the equine community. So please spread the word, visit our website for further information and start to take action. Thank you.
Thank you very much for that, Claire. And also it is lovely to see how it's developed from the discussion we had at NEF last year. So thank you very much, and for all of those involved. Now, I am appreciating that people's stomachs are starting to rumble a little bit. So I'm going to actually just ask one question, and then I will let you know about lunch. So what I would ask is, please, over lunch and the breaks, do speak to Claire and Celia. These are very important initiatives that we are together working on for the benefit of the horses in our care. So I have a question here, and it's to you, Celia, and it really picks up on previous discussions, but with the cost of keeping a horse as it's increasing, is there a danger that owners are going to cut back on vaccinations, and what can we do about that?
Yeah, I think there potentially is, and I know that when we talk with member bodies, one of the dilemmas really is that if you make the requirements for participation too stringent, then there's a danger that you just push people away and out into the free-for-all of the unaffiliated, unregulated. So if you're not careful, you can make things worse. On the other hand, I guess it's individually each horse owner has to decide their own budget priorities, and I would regard influenza and tetanus vaccine as, it's not really an option. A horse has to be fed, it has to be protected, it has to have decent farrier care, and so on and so forth. Where there are other areas, I know in my job as a vet, I see a lot of supplements and different things going on, arguably some of the veterinary tests going on. So it's really for each individual to decide how they're going to set their own budgets. But as I say, I think we have to remember that central to all of this is protecting our horses, and vaccination is a very effective way to do that.
Very sober and pertinent point there.